According to David Dia and Donna Harrington, quote, anxiety disorders are the most common mental health problem in children and adolescents, unquote. Today I'll be informing you about anxiety disorders and their effects. Daphne Watkins defines anxiety as a state of uneasiness or apprehension about future events, potentially due to anticipation of a realistic or fantasized event, and the effects of this can be physically and psychologically impairing. The topic of anxiety has been a prevalent entity in my life in the recent past, and I've been interested in learning about all aspects of anxiety in order to better understand it. It is important to first understand the symptoms, causes, and outcomes of anxiety and how it can affect others, as well as the treatment methods to get it under control. People may identify that they have anxiety by experiencing and recognizing certain symptoms. The symptoms and causes of anxiety must be identified to understand the outcomes. Jim and Marilyn Folk list some of the general symptoms of anxiety. Headaches, neck tension, upset or nervous stomach, nausea, shortness of breath, weakness, electric shock feeling, fear of impending doom, sleep problems, and behaving overly apprehensive. And the symptoms of anxiety may vary from person to person, states Eric Rawson and Catherine Cowan. And these people may have difficulty maintaining friendships, some may behave with more risk and harmful intention, and others may be so affected by their disorder that they avoid school and socialization completely. Gail Christopher and Oliver Davidson say that the potential causes of anxiety may be linked to people who are involved in a civilian trauma, bullying, or who had a high number of life events. And women are also more likely than men to get anxiety. And the results of anxiety and the symptoms are very similar. Anxiety can result in panic attacks, which is generally when patients first seek out help, according to Malcolm Lader. The symptoms of anxiety can be felt by others around people with anxiety, which can affect them as well. Daphne Watkins states that parental mental health can have an effect on their children. It can make their child's behavior problems worse, and children can develop anxiety as well. And she also states that people with more workload and family roles have more anxiety. And this can create bad family relationships and negative parent-child relationships. She also states that non-traditional or split families can have more stress, and this causes anxiety amongst the family members and causes general anxiety due to the feeling that one's family life may be different than others. And there's also anxiety due to sibling interaction, but David Dia and Donna Harrington state that, quote, positive sibling interactions are associated with better friendships, higher self-esteem, and lower levels of loneliness, depression, and delinquent behaviors. And these kids are less likely to develop anxiety, and they have a more general good quality of life. They also say that disorders tend to run in families. Siblings where one has a disorder makes it more likely that other siblings will develop anxiety as well. Parents may develop anxiety due to children having anxiety. And despite its negative outlook, it is controllable with treatment and support. Different treatment methods are offered for people suffering with anxiety. Malcolm Lader says, quote, simple explanation, support, and counseling are sufficient for most patients, especially those with understandable anxiety, unquote. People must have an explanation for their symptoms. They must be reassured that their physical symptoms are due to their anxiety and not a more serious condition. Malcolm Lader also lists different types of treatment methods. One type of treatment method is called applied relaxation, and this involves relaxing certain muscle groups in different positions, which will help to reduce the physical symptoms of anxiety, and this is combined with daily activity. Cognitive therapy is also another technique that is used, and this teaches the patient how to think alternatively to fix or change their misinterpretation of a situation. Counseling is also another option. There's directive counseling, which is a session that is set up with goals for the patient to help them work through their problem. And non-directive counseling is a less structured session where the patient talks about their issues with the counselor and works through their problems that way. And there's also psychotherapies, and the aims of psychotherapies are dependent upon the person, but the most important role of it is to uncover the source of the anxiety. Drug treatment is also another option. but it must be used as part of a management plan and not used alone. This may be used to suppress anxiety, but it does not deal with the root of the problem. And drug use can be tapered off as anxiety becomes more controllable once one identifies the source. And anxiety can have a huge impact on one's life in debilitating ways, but there is hope for those who are suffering. I have informed you today about anxiety and its effects, and we can now understand the symptoms, causes, and outcomes of anxiety and how it affects others, as well as the treatment methods that we can use to get it under control. And patients with anxiety must be cared for based on their individual needs to offer the best results. Thank you.